I'm Dr. Prasenjit Datta. I'm an orthopedic surgeon. Hip fracture, as we commonly see in various patients, consists of two aspects, consists of two types of fracture. One is fracture in the head or the neck of the femur, and fracture just below that, that is fracture in the trochanteric region of the femur. These are the two most common types of hip fractures which we commonly come across in elderly patients in our daily practice. When a elderly person, uh, especially females, crosses her age of 50 years or 60 years, her bones become very osteoporotic. What is osteoporosis? Osteoporosis means the calcium in that person's bones becomes so much reduced in quantity that the bone strength reduces dramatically and the bones become brittle. This is also true for males, but it occurs around 70 to 80 years age in males and it occurs quite early in females. Due to such reduction of calcium in the bones become severely brittle. The three areas of our body which become very brittle are the vertebral spine, the wrist joint, and the bones around the hip joint. So, hip joint is one of the areas which become most brittle in old age. So, whenever a old or elderly woman or a man falls down due to various reasons during their walking inside their house or in the road, the first bone or the most common bone we encounter as fracture is a hip fracture. This is how hip fractures normally occur in elderly people. Hip fracture per se is not like that because people don't die after that fracture, but it is life threatening consequently. How? After a hip fracture, an elderly person cannot walk and he or she lies like a log of wood in the bed. She can't even move, she can't even sit, she can't even walk and go to the bathroom. So, what happens is that due to continuous lying in a certain position for 1 month to 2 months or 3 months, bed sore slowly develops in the patient, which causes increased infection inside the body. A patient who lies, an elderly patient who lies for a long time in the bed, can attract chest infections, urinary tract infections. Her bowel becomes irregular. She suffers from constipation and suffers from stomach infections. These infections gradually leads to ill health in that patient, brings about morbidity, and ultimately causes death in that patient. Thus, hip fractures needs to be treated very early so that we can prevent that unfortunate outcome. Whenever elderly patient falls down on a road or in her house, the first thing we have to look out is if she is complaining of pain around the hip joint or around the knee joint. This is the first thing we have to see. If she has pain, then we should be very careful because there are cases which we have noted as the patient had pain in the hip joint, the patient could walk, the family members made her walk, and this caused displacement of the hip joint fracture and made a simple fracture into a complicated one. So the first thing should be noted is that whether she is having any pain in the hip joint or in the knee joint. The second most obvious thing is that inability to walk. If a person has a comminuted or a severe bad fracture of the hip joint, she would be unable to walk, even walk one step or two steps. And number three is that the affected limb or the affected leg lies listlessly on the bed, and any movement of the bed of the leg is supremely painful. So these are the symptoms to watch out for if you have an elderly patient or a person who have fallen down in front of you, and these symptoms should be enough for a person to suspect a hip fracture. When we get a patient of a hip fracture, we first do an X-ray to see what type of fracture and in which bone is fractured. If the fracture is a hairline fracture, minimally displaced fracture, a very small fracture, then we advise the patient bed rest, give him some calcium and vitamins, and ask him to take rest at home. Usually, hairline fractures around the hip unite well without surgery. But if the patient has a displaced fracture, then plastering is not an option. In these cases, we have to do surgery. When the fracture involves neck of the femur or the head of the femur, we replace the head or the neck of the femur by an artificial implant. The surgery is known as hemiarthroplasty. If the trochanteric region is fractured, that is, the fracture is just below the neck of the femur. In that cases, we fix the fracture by using a rod or a plate. After fixation, we, as per the patient's bones unite, or as per the patient can tolerate, we gradually mobilize the patient. We make him do various exercises. We advise physiotherapy, and after that, the patient can walk and live a normal life after the surgery. That after hip fracture, the patient have severe pain in the hip joint, and there is a lot of bleeding around the hip joint. So the patient's hemoglobin can become suddenly low because of sudden blood loss inside around the hip joint. The patient suffers from severe amount of pain. He or she doesn't move her limb, and thus it may cause bed sores. The patient doesn't feed well or doesn't drink water in fear of unable to go to the bathroom. So she may suffer from urinary tract infection, constipation, bowel symptoms. Any fracture of her body unites by around 1.5 months to 3 months. As hip fractures occurs in the elderly people, so we take a time frame of around 2 months to 3 months for hip joint to recover. If you are doing a hip replacement surgery, then there is no question of the bone to unite, because in that case, the implant that we are inserting inside the hip joint itself take care of weight bearing. So, in case of hip replacement surgeries, we make the patient walk around 2 to 3 days after the surgery itself. But in cases where we have put a nail or a plate for the fractures to unite, we have to wait for the fractures to unite. In those cases, we make the patient to walk after 15 to 20 days. In very old and fragile patients, we make them walk after 1 month, and she becomes completely independent and can walk with a stick or without a stick by 3 months after the surgery. The elderly patient experiences a hip fracture. Most important thing is that we should not ask the patient to walk or to move the patient or mobilize the patient. We should immediately take him or her to the nearest hospital or to the nearest doctor and take his advice and do x-rays to rule out fractures, because There are many cases in which the hip fracture has remained undetected for 3 months or 4 months, and after which the going to the doctor, the X-rays has been done, and that has been detected. And in that cases, any surgery or any treatment of that patient becomes extremely complicated. So, if you suspect a hip fracture, if the patient is complaining of pain in the hip joint, you should immediately take him to the nearest hospital or to the doctor and do a thorough checkup to rule out any fractures in the elderly. Because there are also cases in which there has been no history of fall, no history of injury, but due to extreme fragility of the bones, the patient has suffered a fracture just during her walking or just standing for long hours. So, X-rays and a doctor consultation is a must if anyone suspects a hip fracture. After a fracture is rejected and diagnosed by a doctor, then immediately as per the doctor says, surgery or a bed rest as he has advised, that should be perfectly followed. Because if a patient walks after a hip fracture, then the fracture can be displaced and the patient's pain will be aggravated. And after the fracture is united, it will be united in a very bad position, causing pain and stiffness of the hip joint. So, if excessive stress falls on the hip joint after surgery or after a fracture, then there is a chance of refracture around the hip joint, causing problems for the patient. In cases where a hip replacement surgery has been done, their doctor's advice should be meticulously followed because after hip replacement surgeries, if the patient walk in awkward positions, cross their legs, or sit on floor, there are chances of the hip joint being dislocated, causing pain and complications to the patient. So, doctor's advice should be followed meticulously after a hip joint fracture has occurred. Hip fractures can be prevented if we observe certain things in elderly patients. First of all, we have to improve the bone health or bone strength of the elderly patients. That can be done by regular intake of calcium rich foods, and if required, after consulting the doctor, the patients can take regular calcium supplements, vitamin D. These can strengthen up the bones and can prevent fractures if the injury is on a lighter side. That means it helps in strengthening up the bones. Next most important thing in the elderly is exercise. Elderly patients usually doesn't exercise because of old age. They have pains, they have problems, so they don't like to exercise. But elderly patients should exercise because regular exercise helps to maintain the calcium and helps to strengthen up the muscles, which prevents sudden falls or losing of balance in these elderly patients. So, simple exercises such as walking daily or doing simple free hand exercises can matter a lot in a elderly patients in preventing his or her fractures. The third most important thing is about the family members. In a house in which elderly patients live, the family members should ensure that their rooms are not stuffed or clogged, or there is no water or anything on the floor, which may cause easily the elderly patients to stump and fall or to slip and fall. The bathrooms in which the elderly patients go should have rough surface on which he or she can stand, and it should have handles through which the patients can hold on if he or she is feeling that she may slip. These simple tips or these simple things can prevent fall in the elderly patients and thus prevent hip fractures.